In these various videotapes in the lumbar region, we've talked a lot about discogenic instability. So is there a way to safely stretch our patients who have hypermobility secondary to disc degeneration? We think there is, and incorporates using one of these Swiss balls for support. So in this video clip, we're going to show you how to safely stretch someone with hypermobility into flexion, into side bending, and into extension. So let's start with flexion first. We have the patient get into a double kneeling position behind a therapeutic Swiss ball, then into a quadruped position, and then we have the patient relax and flex themselves over the ball. Notice how my legs, my thighs, are away from the ball. I'm letting my pelvis drop off the lower end of the ball. My pelvis tilts posteriorly, and that brings the flexion into my lumbar spine. And then I flex a little bit over the top edge of the ball, and the whole time the ball is pressing up into my abdomen so that I don't get any excessive anterior translation of lumbar vertebrae. And I flatten my lordosis completely and taken compressive load off the posterior third of the motion segment. So any patient with discogenic instability typically tolerates this stretch well, and it won't make them any worse. And your patients with lumbar spinal stenosis also benefit from this type of controlled and supported flexion self-stretch. Now we're going to go right into lateral bending. If we have our patient roll on the ball and bend their undermost knee and flex their undermost hip, we give them a nice wide base of support, and that's important so the patient doesn't feel like they're going to fall one way or another off the ball. We then extend their uppermost leg. Okay? As we extend their uppermost leg, that helps to drag the pelvis down, and then we support with the underneath arm the head and neck in a mid position. Lastly, in order to get just a little bit more lateral flexion or side bending, we bring the arm up over the head like so. Now in this position, I'm getting a nice amount of left side bending, which opens the intervertebral foramen on the right side of the lumbar spine and stretches the right side of the disc, the right-sided facet joints, and other soft tissue structures on the right side of the disc, which is where the axis of movement is. So this is a nice supported, unloaded way to stretch a spine into lateral bending, okay, even if there's a bit of discogenic hypermobility, discogenic instability. Lastly, we'd like to talk about extension. You have to remember that there's only 20 degrees of thoracic extension and only about 20 degrees of lumbar extension. So the last thing our patients need, particularly if they have discogenic instability, is any excessive hyperextension. So how do we handle extension? We get supine on the ball. We let our pelvis drop just a little bit into an anterior tilt. Okay? That allows the lumbar spine to extend. Now we're going to come up and support the head and neck. And we'll just let our thoracic spine move backward over the top edge of the ball a little bit. Now this is plenty of thoracolumbar extension. Most of our patients don't need any more than this to stretch themselves out of kyphosis and into a nice upright postural position. This is as far as we ever need to go in terms of stretching our patients' thoracic and lumbar spine into extension.